Picture a 64-year-old grandfather standing in his garden on a warm Saturday afternoon. He is holding a hose, watering the tomatoes he planted with his grandson. Suddenly, he feels a strange, light-headed wave pass over him. The world tilts slightly. He blinks, grips the hose a bit tighter, and shakes his head. He tells himself it is just the summer heat, or perhaps he stood up too fast. He ignores it. 2 months later, that same man is sitting in an emergency room with ankles so swollen his shoes will not fit, and a heart that is struggling to pump fluid through his body. The silent shift had already occurred. 1 out of every 3 seniors over the age of 60 is currently taking a little yellow or white pill called amlodipine to lower their blood pressure. That is millions of people opening a prescription bottle every single morning. Yet a staggering number of these individuals are completely unaware of the subtle, creeping changes happening beneath their skin. It feels close to home because it is. Someone you love is likely swallowing this exact medication right now without knowing the full story. There is a hidden truth about this incredibly common medication that rarely makes it onto the warning label in plain English. The medical system operates on a high-volume schedule, meaning the deeper realities of how this drug alters your daily vitality are often left in the shadows. You are handed a white paper insert covered in microscopic text that requires a magnifying glass to read, and you are sent on your way. By the time you finish watching this video, you will know the 9 serious side effects of amlodipine that seniors are almost never warned about. You will understand exactly how this compound changes the mechanics of your cardiovascular system, what signs to look for during your morning routine, and the precise steps you can take to protect your health while working safely with your physician. Most people believe that if a medication is prescribed by a doctor and taken by millions of others, it is completely harmless and requires no close monitoring. That belief is costing people their health. The medical literature on this is unambiguous, and it reveals that long-term use in mature bodies requires deep vigilance. Your body is not a machine that takes a pill without adapting. Your habits must adapt too. Subscribe to Fauci Health Insights right now and tap like. It takes 4 seconds, and it matters more than you think. We are working toward 50,000 subscribers, and we are building this channel on a single principle. The traditional medical system makes its money when you stay dependent on chronic management. It does not prioritize teaching you how to naturally restore your vitality. What I am about to tell you, your doctor will not have time to say at your next brief 10-minute appointment. There is simply no time for it in the current layout. And frankly, there is no financial incentive for the system to educate you at this level either. So let me show you what is actually happening inside your body. Because once you understand the mechanism, you will never dismiss these signals again. Let us look at the vascular system, the massive, intricate network of blood vessels that travels to every single square inch of your flesh. To understand how your blood pressure medication works, think of your blood vessels as a household plumbing system. Specifically, imagine a flexible, high-grade garden hose. A healthy hose is pliable, strong, and handles water pressure smoothly because its internal walls are resilient and dynamic. In a perfectly healthy body, these vessel walls constantly contract and relax to guide your blood precisely where it needs to go. When you walk, they open up to feed your legs. When you eat, they redirect flow to your stomach. It is a flawless, automatic dance. High blood pressure occurs when those hoses become stiff, narrow, or clogged, forcing your heart to pump with dangerous force to move the fluid. Amlodipine steps in as a calcium channel blocker, which is just the medical phrase for a chemical wedge that forces the muscles inside your blood vessel walls to completely relax. It essentially forces the garden hose to open up as wide as possible, which instantly drops the pressure inside the system. But here is why this process gets missed for so long by the average person. Your body is incredibly adaptive, and it will violently try to compensate for this forced widening of the pipes. Because the medication works mechanically on the vessels rather than fixing the original reason the pressure was high, your internal chemistry begins to shift silently. You feel fine, Your numbers look beautiful on the little digital monitor at home, but beneath the surface, a structural tipping point is slowly building. The hidden damage accumulates without a whisper. Your body hides the strain until the fluid balances are so disrupted that a visible crisis finally breaks through. Sign 1. The heavy ankle syndrome picture, a 68-year-old woman sitting in her favorite armchair at 7 o'clock in the evening. She goes to untie her sneakers and notices a deep red indentation cut into her skin from her socks. Her ankles look thick, heavy, and completely unrecognizable. She presses her thumb into the skin near her ankle bone, and the indentation stays there like a footprint in wet mud. Here is what is actually happening inside your body at that moment. Because amlodipine forces the tiny microscopic gates in your arteries to open wide, blood rushes down into your lower legs with immense force. However, the medication does not widen the veins, the return pipes that carry blood back up to your heart. This creates a massive traffic jam. The fluid has nowhere to go, so it gets pushed out of the blood vessels and leaks directly into the surrounding flesh of your feet and calves. Most people look at this fluid buildup and tell themselves they just spent too much time on their feet or ate too much salt at lunch. They assume it is a natural part of getting older. That excuse is dangerous because this is not a natural aging process. It is a structural fluid shift. If this sign is ignored for months or years, the constant presence of stagnant fluid destroys the health of your lower skin tissues. It can lead to chronic skin breakdown, severe infections, and permanent changes to your local circulation. The clinical name for this is peripheral edema, which simply means fluid accumulation in the extremities. And when a cardiologist sees this, they do not dismiss it. They immediately recognize that the physical plumbing of the body is being overwhelmed by the medication's direct mechanism. But that is only the first piece. The next sign is even easier to mistake for normal aging. Sign 2, the afternoon brain fog. Imagine sitting at your dining room table at 2 o'clock in the afternoon, trying to read a book or fill out a crossword puzzle. Suddenly, a thick, heavy cloud rolls over your mind. You find yourself reading the same sentence 4 times without absorbing a single word. You feel a deep, low-grade dizziness when you turn your head too quickly. Inside your skull, a very specific pressure drop is occurring. Your brain requires a continuous, powerful, and perfectly regulated stream of blood to deliver oxygen to its billions of working cells. When amlodipine widens your systemic blood vessels, it can drop your blood pressure so low during peak hours of medication absorption that the upward flow against gravity becomes sluggish. Your brain is essentially experiencing a brief, temporary drought of optimal oxygenation. The average senior shrugs this off and blames it on a poor night's sleep or the fact that they are just slowing down in their 60s. They pour another cup of coffee or take a nap, assuming their mind is simply losing its edge. When you constantly deprive your brain tissue of optimal pressure, you increase your risk of falls, balance loss, and sudden fainting spells. The brain cells are not broken. They are simply starving for steady pressure. Doctors refer to this dynamic as symptomatic hypotension, which is the clinical term for low blood pressure that actively impairs how you feel. When a patient reports this, a trained eye looks closely at the timing of the dose because it signals that the medication is working too aggressively. Let us move to the third warning sign, which directly targets your energy, sign 3. The persistent muscle weakness picture, a gentleman trying to walk up the flight of stairs in his home to grab a jacket. Halfway up the steps, his thighs feel like they are filled with heavy lead. He is not out of breath, but his muscles simply refuse to push him upward with the strength he had just a few months ago. Later that evening, he experiences a sudden, sharp cramp in his calves while lying in bed. This happens because of a profound cellular disruption. Amlodipine functions by blocking calcium channels, which are the microscopic doorways that allow calcium ions to enter vascular muscle cells. However, your skeletal muscles, the actual meat and fiber that moves your arms and legs, also rely heavily on precise mineral balances to contract and relax. By altering how calcium moves across cellular membranes, the medication can inadvertently disrupt the electrical and chemical firing of your physical movement system. Seniors routinely assume that this weakness is just sarcopenia, which is the medical term for natural age-related muscle loss. They tell themselves they need to accept that they can no longer walk as far or carry the groceries. Ignoring this progressive weakness leads to a sedentary lifestyle, which rapidly accelerates cardiovascular decline and destroys joint stability. Your muscles are sending a clear warning that their internal chemical environment is completely out of balance. The medical term for this altered state is drug-induced myopathy, which translates to muscle distress caused by a therapeutic substance. A cardiologist notes this immediately because it indicates the medication's effects are spilling over past the blood vessels and into the broader musculoskeletal framework. The fourth sign is one that deeply affects your daily comfort. Sign 4. The unprovoked flushing and heat. Imagine sitting in a perfectly cool, air-conditioned room while watching television. Out of nowhere, an intense wave of heat rushes up your neck and spreads across your cheeks. Your skin turns a bright crimson red, and you begin to sweat as if you were standing out in a humid desert. You check the thermostat, but the room is 70 degrees. What is happening inside your body is an abrupt failure of temperature regulation. The medication forces the tiny blood vessels right beneath the surface of your facial skin to dilate completely without warning. This allows a massive volume of warm, core blood to flood the surface layers of your skin all at once, overriding your body's natural thermostat control. Most individuals assume they are just experiencing a late-life hormonal shift or that the room must actually be warm. They open a window or turn on a fan, dismissing it as an annoying quirk of their body. The danger here is that frequent, uncontrolled flushing puts a continuous strain on the delicate capillaries, the ultra-thin blood vessels near the surface of your face. This can lead to permanent redness, broken vessels, and systemic discomfort that disrupts your sleep and peace of mind. This reaction is known clinically as cutaneous vasodilation, the sudden opening of surface skin vessels, and it is a classic sign that the drug is achieving a high concentration in your bloodstream very rapidly. This leads directly to the fifth serious side effect, which involves your digestive tract. Sign 5. The chronic morning constipation picture, waking up at 6 in the morning, taking your morning glass of water, and heading to the restroom. Instead of a smooth, natural daily elimination, you experience a painful, straining struggle that leaves you feeling bloated and uncomfortable for the rest of the morning. This becomes your new reality day after day. This occurs because your digestive tract is entirely lined with smooth muscle tissue that operates like a slow-moving conveyor belt to push food through your system. Because amlodipine blocks calcium channels to relax smooth muscles, it does not just relax your blood vessels. It also paralyzes the smooth muscle walls of your intestines, slowing the conveyor belt down to an absolute crawl. The waste sits inside your colon too long, dries out, and becomes incredibly difficult to move. Seniors almost universally blame this on their diet, concluding they simply need more fiber or that their digestion is naturally dying out due to age. They begin buying over-the-counter laxatives, which further irritates their internal lining. Chronic straining poses a massive danger to older adults because it raises intracranial pressure, the pressure inside your skull, and can trigger dangerous spikes in heart rate during elimination. It also leads to painful hemorrhoids and severe impaction. The clinical diagnosis is drug-induced intestinal hypomotility, which means slow bowel movement caused by a medication, and it requires a structural adjustment rather than endless laxative use. The sixth sign is one that many seniors find highly alarming. Sign 6. The unexplained heart palpitations. Imagine lying perfectly still in your bed at night, surrounded by silence. Suddenly, you feel your heart leap inside your chest. It starts thumping wildly against your ribs. Thump, thump, flutter, thump. It feels as though you just ran a sprint, even though you are simply resting on your pillow. This is a direct mechanical reflex of your nervous system. When amlodipine lowers your blood pressure very quickly, your body's internal pressure sensors, called baroreceptors, detect the sudden drop. They panic, thinking you are bleeding out or losing fluid rapidly. In response, They send a high-speed emergency signal to your brain, which floods your heart with adrenaline, forcing it to beat faster and harder to compensate for the wide-open vessels. The average person assumes they are experiencing an anxiety attack or that they drank too much caffeine during the evening. They sit up, try to breathe deeply, and wait for it to pass, feeling a deep sense of dread. Reflex tachycardia, which is the medical term for a rapid heart rate triggered by a drop in blood pressure, places an immense workload on an aging heart muscle. If your heart is forced to pump frantically against a medication-induced pressure drop, it can trigger localized chest pain and exhaust the cardiac muscle. Cardiologists take this signal with absolute seriousness because it shows the drug is causing an unstable tug-of-war between your blood vessels and your nervous system. This brings us to the seventh sign, which involves your oral health. Sign 7, swollen and bleeding gums picture, standing in front of your bathroom mirror, brushing your teeth. You spit into the sink and notice a bright pool of dark blood. When you look closely at your mouth, your gums look puffy, oversized, and seem to be literally growing over your teeth, changing the way your smile looks. Inside your mouth, a pathological tissue overgrowth is taking place. The presence of amlodipine alters the way the structural cells of your gums, called fibroblasts, handle collagen and cellular turnover. This causes the tissue to multiply abnormally fast, creating an overabundance of spongy, inflamed gum tissue that traps bacteria and bleeds at the slightest touch. Most seniors assume they are just developing standard gingivitis or that they brushed their teeth too hard that morning. They switch to a softer brush, hoping the bleeding will eventually stop on its own. Allowing this overgrowth to continue destroys the deep bone structure supporting your teeth, leading to loose teeth, severe periodontal disease, and systemic inflammation that threatens your entire heart. The exact clinical name for this condition is gingival hyperplasia, which means the abnormal multiplication of cells in the gum tissue, and it is a well-documented side effect that requires immediate medical coordination between your dentist and your cardiologist. The eighth sign involves your respiratory system, sign 8. The dry, persistent night cough. Imagine trying to drift off to sleep, but every time your head hits the pillow, a tickle develops at the back of your throat. It forces you into a dry, hacking cough that produces absolutely no phlegm. You sip water, you prop yourself up on 3 pillows, but the dry hacking keeps you awake until the early hours of the morning. While this is more famously known with a different class of blood pressure drugs, calcium channel blockers like amlodipine can alter local prostaglandin pathways, which are specific chemical messengers that regulate inflammation and nerve sensitivity in your airway tissues. When these chemicals are altered, the nerves in your throat become hypersensitive, misfiring continuously as if an irritant were permanently stuck there. Seniors naturally assume they are catching a cold, developing seasonal allergies, or suffering from a mild case of acid reflux from dinner. They take over-the-counter cough syrups, which do absolutely nothing to stop the chemical misfiring. A persistent night cough strips you of deep, restorative sleep, which is the exact time your body uses to repair its blood vessels and lower its stress hormones naturally. Lack of sleep drives blood pressure higher, defeating the very purpose of the medication. Doctors categorize this as a drug-induced respiratory hypersensitivity, and it can only be resolved by evaluating the true chemical source of the nerve irritation. Now, let us look at the final deeply impactful sign, sign 9, deep mood fluctuations and lethargy picture, a 72-year-old grandfather who used to love tinkering in his garage or playing cards with his friends. Over the course of a few months, he stops going out. He feels a profound weight of apathy pressing down on him. He feels sad, detached, and lacks the mental drive to do anything more than sit and watch the news all day. This occurs because calcium channels are not just located in your blood vessels. They are highly concentrated throughout your central nervous system and brain. Calcium signaling is the fundamental mechanism that allows your brain cells to release neurotransmitters, the chemical messengers like serotonin and dopamine that dictate your joy, drive, and stability. By dulling these calcium pathways, The drug can quiet down your brain's emotional circuitry. Family members often look at this and assume it is just a normal sign of aging, or they believe the person is simply getting grumpy and lazy as they grow older. This assumption is deeply tragic. Allowing a medication-induced depressive state to go unchecked destroys an older adult's quality of life, completely isolates them from their community, and removes the physical vitality needed to stay active and healthy. This condition is recognized in clinical literature as drug-induced depressive syndrome, and it requires an empathetic review of how the medication is impacting the delicate chemistry of the mind. I will call her Dorothy. 71 years old, the kind of woman who had raised 4 children, managed a household for 40 years, and had never once in her life gone to the doctor without being dragged there by her family. She had been prescribed amlodipine 2 years prior for moderate high blood pressure, and her numbers looked perfectly acceptable on the clinic chart. However, Dorothy had stopped going on her daily morning walks with her neighborhood friends because her ankles had become so heavy and thick that she could no longer fit her feet into her favorite walking shoes. She had also developed a quiet, heavy sadness that kept her sitting in her living room with the curtains drawn, believing she was simply wearing out. She bought larger shoes, started taking over-the-counter fluid pills, and completely cut herself off from her social life. During an annual evaluation, I stopped asking about her blood pressure numbers. I started asking about how she lived her daily life. When we looked at her swollen limbs, she looked at me very quietly and said, "I thought that was just what getting older felt like." That sentence has stayed with me for years. We immediately recognized that the medication's mechanical side effects were completely destroying her lifestyle. We slowly, safely titrated her off the amlodipine under strict supervision, replaced it with a targeted lifestyle approach, and within 6 weeks, her fluid retention vanished, her mood lifted, and she was back on her morning walks. She left that experience a completely different person because we explained the mechanism rather than just treating a number. Let me now show you what is actually happening underneath all of these signs, because it is happening in the majority of people watching this right now, and almost none of them know it. The true root cause of high blood pressure is almost never a lack of amlodipine in your system. The upstream mechanism driving the stiffness of your arterial garden hose is a deep systemic inflammation and a loss of flexibility in the lining of your blood vessels. When your lifestyle habits create a state of high oxidative stress, which is the medical term for cellular rust inside your body, your vessels harden up like old plastic pipes. This root cause goes completely undetected for decades because you cannot feel your blood vessel lining hardening. It feels like absolutely nothing. That is the point. Think back to our garden hose metaphor. If you leave a plastic hose out in the freezing cold and baking sun for years, it becomes brittle. If you suddenly force water through it at high volume, it threatens to burst. The medical system uses a drug to forcefully widen the brittle hose, but it does absolutely nothing to restore the soft, supple, youthful rubber material of the hose itself. The underlying rust keeps burning beneath the surface. The moment the hidden damage becomes a visible crisis is when the vessel lining gets so brittle that it tears, forming a sudden blood clot that cuts off blood flow entirely. By that point, it is often too late to prevent catastrophic damage because the structural integrity of the pipe was completely ignored in favor of a short-term pressure fix. Now, I want to tell you about the everyday things you are probably doing right now that are making this process faster. Some of them will genuinely surprise you. First, consider the frequent consumption of standard store-bought vegetable oils, such as canola or soybean oil, which most people believe are completely heart-healthy. These oils are packed with omega-6 fatty acids that undergo extreme heat processing, creating a fluid that causes immediate cellular rust inside your vessel lining when consumed daily. The oxidized fats embed themselves directly into your arterial walls, accelerating the hardening of your pipes. Second, look at the common habit of eating processed low-fat packaged foods like commercial breads and cereals. To make these foods taste acceptable without fat, manufacturers pack them with refined starches and hidden sugars. These sugars cause sharp spikes in your blood glucose, which chemically caramelizes the protein structures inside your arteries, making them incredibly stiff and non-reactive. Finally, consider the habit of sitting completely still for hours after eating a heavy evening meal. When you remain motionless, your blood flow becomes sluggish, allowing inflammatory compounds to sit against your vessel walls for extended periods, accelerating structural damage. Now, let me show you what actually works and why it works at a level your body can feel within days. The Vascular Supple Protocol is a specific three-phase daily routine designed to naturally lower systemic resistance and support vessel elasticity without forcing a chemical wedge into your cells. Morning, the first 10 minutes. Immediately upon waking, drink exactly 500 milliliters of pure water, that is 2 standard glasses, before you touch coffee, food, or medication. Your blood is at its absolute thickest and most clot-prone after 8 hours of sleep without fluid, which is why morning is the highest risk window for cardiovascular events. Hydrating instantly thins your bloodstream, reducing the workload on your heart. A common mistake is drinking ice-cold water, which can shock your stomach. Use room temperature water to ensure rapid absorption. Daytime, the nitric activation. At 1 o'clock in the afternoon, perform 5 repetitions of a gentle wall sit exercise. Stand with your back flat against a sturdy wall. Slide your hips down until your knees are bent at a comfortable 45-degree angle. And hold that position for exactly 20 seconds while breathing deeply through your nose. This specific positioning forces your large thigh muscles to demand blood flow, triggering your vessel lining to naturally release a gas called nitric oxide, which is your body's own natural non-chemical pipe dilator. If you have severe knee arthritis or joint injuries, skip the bend and simply perform gentle heel lifts while holding onto a chair. Evening, the mineral restoration. At 7 o'clock in the evening, consume a small bowl of steamed dark leafy greens, such as spinach or kale, lightly drizzled with high-quality extra virgin olive oil. These greens are rich in bioavailable magnesium and natural nitrates, which act as a gentle, organic muscle relaxant for your digestive tract and blood vessels, helping to counteract the nighttime stiffness and morning constipation often triggered by medications. Please note a gentle warning. If you are currently taking any prescribed cardiovascular medication, you must check with your doctor before making sudden changes to your routine, as your pressures may drop naturally, requiring a supervised reduction in your medical dose. Consistent practice of this protocol produces an observable improvement in your lower limb fluid balance and overall mental clarity within 14 to 21 days. Now, here is something I want you to think about. Your age changes everything about how quickly structural damage develops in your body. The same elevated pressure does twice the damage at 60 that it does at 40 because older blood vessels have less natural collagen reserve to buffer the stress. Research shows that in people over 55, ignoring cardiovascular vessel stiffness increases the long-term risk of a major circulatory crisis by over 60%. How old are you right now? Write it in the comments section below. I am not asking out of curiosity. I want to know which age group I am speaking to most because it shapes every piece of educational content I create next. Here is exactly what to do after this video ends. Fill a glass container with 500 milliliters of water right now and set it on your nightstand so it is ready for your morning routine tomorrow. Take a black marker and gently draw a small, precise line on your ankle bone tonight to serve as a visual reference point for tracking any daily fluid changes. Inspect your current bottle of medication to confirm your exact daily dose of amlodipine so you have the clear facts ready for your next discussion. Schedule a non-emergency phone consultation or appointment with your primary care provider this week to discuss your current cardiovascular progress. Drop down a list of any subtle symptoms you have experienced, such as afternoon fog or evening swelling, noting the exact times they occur. Request your physician to run a specific blood test called a high-sensitivity C-reactive protein evaluation, which is the standard medical test used to measure the exact level of hidden inflammation inside your blood vessels. Walk over to your kitchen cabinet right now, check your cooking oils, and replace any heavily processed vegetable oils with pure, cold-pressed olive oil. Start with step 1. Do it today. The rest will follow. Everything I have shared today is for education and understanding. Your situation is specific to you. Use this as the starting point for a real conversation with your own doctor, not as a replacement for one. I am Dr. Anthony Fauci, and I have spent over 15 years in clinical practice working directly with mature adults, trying to navigate the complexities of cardiovascular health. I created this specific channel because I have sat across the desk from far too many patients who felt completely blindsided by the physical side effects of their standard prescriptions. It deep within my soul motivates me to see people lose their daily independence and joy simply because nobody took the time to explain how their body works at a fundamental level. This critical information is not reaching you through normal medical channels because the modern insurance-driven system is built entirely on brief, high-speed encounters designed to manage symptoms with a pen and a prescription pad. The visit that takes 20 minutes to thoroughly educate you on vascular health and root cause nutrition simply does not fit into the high-volume corporate structure that dominates modern healthcare today. This channel exists because that operational math is completely unacceptable to me as a medical professional. If this reached you at the right moment, click that subscribe button right now to help us reach our goal of 50 zero-informed viewers, and send this video to one person who needs to hear this truth. You may never know what that one simple share does for them.